bag in pharmacology JPR. To start, the JPR is headed by this. Given the various pharmacological agents used in EMS, the EMT paramedic should be able to locate and identify pharmacological agents within their scope of practice. The EMT paramedic shall also be able to correctly secure the drug bag per current WFRD standards. This is the pass-fail criteria of the JPR. You're going to need to know the location of the drug bags on the WFRD vehicles, including the supplemental cells, respectively kept in the ambulances. Demonstrate knowledge of indications, contraindications, routes, actions, and side effects of each drug within your scope of practice. Demonstrate the ability to correctly locate specific agents or drugs when requested by another EMS provider, and make sure that you can advise them of the proper way to deliver them. Discuss associated syringes, needles, etc. that may be required in the administration of specific pharmacological agents. Discuss the use of a three-way stopcock to assist in medication administration for the pediatric patient. And discuss our procedures of the monthly drug inventory, which should be done the 25th of each month. Before we get into the drugs specifically, we're going to discuss the 7 rights of medication administration briefly. We're going to right patient, right drug, right dose, right timing of administration, right route and site, the correct reason, right reason, whether it is indicated or contraindicated, and then the right documentation. To begin, we're going to talk about the stopcock real quick. This is a pretty useful device, especially when needing to give drugs to a pediatric patient. It allows you to transfer from a bigger syringe into a tinier syringe to be able to correctly dose the smaller dosages needed to provide to the pediatric patient. The blue hookup at the top is for one of the syringes. The other blue hookup on the side is for the syringe that you'll be providing the pediatric dose with. And then the hookup down at the bottom is what's going to go onto the IV tubing or the J-loop. And then just like our pressure infuser bag, it has a 3-way stopper, so just make sure it's located in the right area to start and stop the administration as needed. The first drug we're going to cover is mag sulfate. Indications for this: severe asthma, responds poorly to epi, critical asthmatic, torsades de pointus, preeclampsia or eclampsia to prevent seizures, or if online medical control orders for life-threatening ventricular dysrhythmias due to digitalis toxicity, or to stop preterm labor. Contraindications include hypocalcemia, heart block, or renal dysfunction. Precaution with continuous monitor EKG, respiratory rate, and blood pressure during administration due to the smooth muscle relaxant ability of this, as well as a patient on digitalis as a precaution. The adult dose that we provide for the asthma, torsades, and eclampsia patient is 2 grams in 16 mLs normal saline, or the 2 grams in 50 ml piggyback given over 5 to 10 minutes. And for the eclampsia dose, you can repeat the adult dose to a total dose of 4 grams if the seizure occurs. It is packaged in a 1 gram, 2 ml vial, which we carry 4 of, or the 2 grams and 50 ml piggyback bag. Next drug is sodium bicarb. We give this for known hyperkalemia, cardiac arrest with metabolic acidosis, or severe renal disease, DKA, drug use, aspirin, tricyclic antidepressant overdose, calcium blocking agents, cocaine, barbiturates, methyl alcohol, hemolytic reactions, or overdose on Benadryl, diphenhydramine. We also provide this for a crush syndrome. Contraindications include alkalosis or inability to ventilate due to the fact that it creates CO2 as a byproduct. Not useful or effective in hypercarbic acidosis, cardiac arrest, and CPR without effective ventilations. Incompatible with catecholamines or calcium agents in the same IV line. We know that if we're going to provide this along with epi and a full arrest, we need to make sure we flush the line. Again, we give this dose of the 1 milliequivalent per kilogram up to 50 milliequivalents, because that's what we carry. You can repeat if the blood pressure drops, altered mental status, or QRS is widening in your tricyclic overdoses or your cardiac arrest with pre-existing acidosis. And then it is also 50 milliequivalents for the dialysis, renal failure with hyperkalemia or crush syndrome, hopefully provided over 5 minutes. It is packaged in 50 milliequivalents in the amp. TXA indications, so long as they're over 16 years old and under 3 hours post-bleeding onset. Hemorrhagic shock, the blood pressure systolic is under 90, heart rate is over 110, multi-system trauma, major pelvic fracture, solid organ injury with evidence of active hemorrhage, traumatic amputations or postpartum hemorrhage. Contraindications include subarachnoid hemorrhage, known isolated head injury, active intravascular clotting or DIC, and or known history of thromboembolism, known history of renal failure, or concomitant use with PCC, prothrombin complex concentrate. The loading bolus dose that we are supposed to provide and what we carry is 1 gram in 100 mLs normal saline, IV piggyback over 10 minutes. 1 gram, 10 minutes, 100 mLs. You're just adding zeros. Aspirin, we're going to cover a couple of the ALS and a couple of the BLS drugs. Aspirin, suspected ACS is the indication, angina equivalents, and AMI, regardless of pain. Unless contraindicated or adequate dose of immediate release aspirin can be verified as taken. So we're going to provide this for chest pain or angina equivalents unless they said they've already taken it. Contraindicated in children under 18, altered mental status, chest pain following trauma, prior to CT, especially head trauma, possible stroke or intracranial hemorrhage, currently vomiting, or surgery within 2 weeks, bleeding disorders, or over 6 months pregnant, and then active peptic ulcer or severe liver disease. Again, those are contraindications. And we provide 324 milligram or 4 81 milligram tabs. The next drug is albuterol. We provide this for bronchospasm associated with asthma, COPD, allergic reactions, croup or cystic fibrosis, as well as hyperkalemia. Precautions is it is a cardiac stimulant used with caution in patients with chest pain, dysrhythmias, symptomatic tachycardia, diabetes, hypertension, seizure, or active labor. Hypoxia may increase incidence of cardiovascular SE. Indications are, for the bronchospasm, we provide 2.5 milligrams. Just the standard tube is 2.5 milligrams of albuterol in 3 mLs. We provide that through handheld neb or a mask neb. And for hyperkalemia, we're going to double that. Hyperkalemia, we're going to double down 5 milligrams. Next is Benadryl or diphenhydramine. It is given for allergic reactions and anaphylaxis. And then per online medical control, a dystonic reaction due to phenothiazines. So if you have a dystonic reaction due to taking too much thorazine, compazine, stelazine, or prolixin, contraindications in acute asthma attack or history of asthma with current allergic reaction should be okay to use in that. Precautions with, do not give sub-Q. Peds likely to have CNS stimulation versus sedation. Angle closure glaucoma or prostatic hypertrophy. I know a warning that I like to provide to the newer medic students is if you are going to be giving this IV, please give it slow. It will make your patient vomit. We give the dose of 1 milligram per kilogram up to 50. Unless they are emergent or critical allergic reaction, then we just give 50. It is packaged in 50 milligrams in 1 ml. Ipratropium bromide or Atrovent. Now, we provide this for bronchospasm associated with moderate to severe allergic reaction or COPD and asthma. Considered relatively safe to use in pregnant women. Precautions are patients allergic to peanut allergies. May safely use the nib solution. Contact medical control. Check with your patient to see if they're okay with it. Precautions also with a bladder neck obstruction, a prostate hypertrophy, or narrow angle glaucoma. We provide the adult dose of 0.5 milligrams in 3 mLs. Again, just one of the little squeezers that we carry. Next drug we are going to cover is Epi 1 milligram in 1 ml, Epi 1 to 1. Indications for EMS for this are moderate allergic reaction as an IM, anaphylaxis with no IV or IO, we're going to provide it IM again, and then moderate to severe asthma. Contraindications and precautions that cover this are contraindications are VTAC due to cocaine use, naturally, and precaution with this drug is give O2, monitor EKG and vital signs when providing epi. I think with the causes we can pretty much figure that one out ourselves. It is inactivated in an alkaline solution, so don't mix it with bicarb in the IV tubing at the same time. Also, don't put 1 milligram in 1 ml epi in an IV tube. Other than that, we provide the 1 milligram in 1 ml dose for adult emergent allergic reaction and critical asthma. We're going to provide 0.3 milligram IM for a, I guess I would describe a moderate allergic reaction. 0.3 in allergic asthma is going to get the 0.3 dose, or a critical adult anaphylaxis with no IV is going to get a 0.5 milligram IM dose immediately. Next, we're going to cover glucagon. Oh, I'm sorry. In the epi, it is packaged in 1 milligram in 1 ml. The glucagon indications are hypoglycemia without an IV or an IO, as well as anaphylaxis with a history of cardiovascular disease, hypertension, pregnant, or on beta blockers. And then symptomatic bradycardia with pulse and on beta blockers and unresponsive to drugs and pacing is when we would provide glucagon. So it's pretty far down in that bradycardic protocol. Contraindications are adrenal insufficiency or adrenal tumor. Precautions with glucagon. It's not as effective for hypoglycemia if no glycogen stores in the peds, malnourished state, uremic or liver disease. Give supplemental carbohydrate ASAP. Our dose that we provide to an adult is a 1 milligram IM or IN dose, and then it is packaged in 1 milligram in 1 ml. Next drug we're going to cover is Narcan. It is a narcotic, synthetic narcotic overdose with altered mental status and respiratory depression. Mostly respiratory depression. The system is big on that. If you're giving Narcan, better have respiratory depression. Coma of unknown etiology with respiratory depression, then may or may not have constricted pupils based on drug combinations. Precautions with Narcan. Rapid reversal may result in opiate withdrawal syndrome. Somebody could be agitated, combative, uncooperative, and a rapid heart rate. I think that's just angry because we may have ruined their high. Another precaution is give O2 while prepping med to prevent reverse tachycardia. Also, use with caution in infants of addicted moms or patients dependent on opiates with cardiovascular disease. Contact medical control. The adult dose we provide is 1 milligram. For this, it will be IM or IN. 1 milligram may repeat every 30 seconds until breathing resumes or improves. Up to 4 milligrams additional doses. Call online medical control. It is packaged in a 2 milligram per 2 ml dose. Ondansetron, we provide Zofran or ondansetron for nausea and vomiting. Precautions of PKU or phenylketonuria if you've got ketones in your urine. The ODT contains aspartame and that forms phenylalanine. I don't know if I'm going to ask a patient that, I got to be honest. Note, don't push ODT through blister foil package. Tabs are fragile. The adult dose we provide is 4 milligram oral dissolved tablet or 4 milligram IV push over 30 seconds, no less than 30 seconds. May repeat in 10 minutes. Total dose of 8. They are packaged in a 4 milligram tab or a 4 milligram per 2 ml. Nitroglycerin. Indications of ACS with suspected ischemic pain, pulmonary edema, or hypertensive crisis with chest pain and pulmonary edema. Contraindications and precautions. Contraindications and precautions of ACS. Your first dose, if your blood pressure is under 90, you're going to want fluid challenges ready. So don't provide it if your blood pressure is under 90. Also, if your heart rate is under 50 or over 100 without heart failure. If you have heart failure, you don't want to provide it if your blood pressure is under 90 over 60. Use with caution in preload dependent patients, i.e. the inferior wall STEMI or ST elevated V4R, especially if bradycardic. Start an IV first, monitor for hypoperfusion, and it's also contraindicated for raised ICP, glaucoma, in patients under 18. Other contraindications do include recent use of sildenafil or ED meds, Viagra, Revatio, Vardenafil, Levitra, Staxacin within 24 hours. It does include Cialis and Adcirca. Patients receiving IV epoprostenol or flolalin for pulmonary hypertension. So if they're receiving IV meds for hypertension, we're not going to want to provide nitroglycerin. We do provide 0.4 milligram tabs. They are packaged in also 0.4 milligram tabs. Oral glucose. Indications are hypoglycemia in the awake patient with a Glasgow of 14 to 15 and an intact gag reflex. Basically, if they can answer questions, you should be able to provide this so long as their sugar is low. We're not going to provide this. Contraindicated in a Glasgow under 13, absent gag reflex or impaired airway reflexes or history of recent seizure activity. Now, the dose we provide is a 25 grams orally. The tube is 37.5 grams itself. So, should be it. Please make sure that you study up the drug box, the location, the various sizes of tubing, including micro, macro, and piggyback tubing. Familiarize yourself with the dial of flow and the medications that you can use that. To spare everybody some time, I didn't cover every single drug in the book because that's something that you guys may be better well suited to do by yourself. But do pay attention to those drugs that we do provide over time, or the obscure drugs that we don't use all that much, as I did hit some of them. Thank you very much.